opportunity to CSF for this great opportunity for me. Let's go into this as soon as possible. Share medical appointment, a strategy to enhance knowledge and peer support among type 1 diabetes patients in Maryland County, Southeast Liberia. This is one of our funniest piece of work we've done. Share medical appointment, what it is an innovative patient-centered care strategy in which the patient with type 1 diabetes, for example, attend clinic on the same day. It combines the individual medical evaluation with group education, peer support, and lifestyle counseling. Since 2017, the government of Liberia and PIH have collaborated to establish Maryland County as the model for universal health coverage using this innovative nurse-led shared medical appointment for type 1 diabetes in 3 PEN+ clinics. Next slide. So let's look at a little bit of Maryland County. Is one of the 15 counties in Liberia in the southeast. It's located in the southeast. Is the 9th most least populated county, approximately with 172,202 residents. It's bordered by Grand Creek, River G on the north, and you have Ivory Coast, our neighboring country, on the east. Gigi Dawson, Plibo Health Center, and Ide Wadis are the 3 facilities supported by PIH Liberia, where we have the PEN+ clinic, and we have this idea of shared medical appointment for type 1 diabetes. Please, next slide. All right, so a little bit of background of why it is diabetes. Is actually a chronic care condition that occurs when one's body has no capacity to produce enough insulin, or insulin is not produced at all. Our main focus is on this PEN+ condition, which is type 1 diabetes, which occurs in children. It's the major one that occurs in children, though it happens at any other age and may require insulin for one to survive. So it's a severe NCD condition requiring quality treatment, education, support to be able to achieve glycemic control or targets. Now, its care entails daily insulin management and the implementation of sustainable and positive health behaviors. Next slide. Now, if we look a little bit of epidemiology of diabetes highlights, according to the 2024 RDF estimates, you see like 1.8 million of children and adolescents below 20 years have type 1 diabetes, according to the RDF. And this is a wake-up call for everyone in PEN+ to making sure that these children living with type 1 diabetes, most especially in resource-limited setting, are cared for and are given the quality of care that they deserve. Next slide, please. Now, we look at these diagnostic criteria. We took them into consideration. These are our diagnostic criteria we use. We want to make sure that this person is actually living with diabetes. We have the fasting blood glucose, we have the 2-hour plasma glucose, and most of all, we have the HbA1c. Planetary Health and the government of Liberia has made it possible for Maryland County, which is one of the 5 most counties to have this point of care HbA1c for our patients living with type 1 diabetes. And its cutoff point for diagnosing diabetes is at least 6.5%. Next slide. So, majority of type 1 diabetes daily management tasks are patient-led. As such, patient knowledge about type 1 diabetes and its management is low and require improvement to enhance behavior change and prevent complications. So in this our work, we present the experiences of Partnering Health Liberia and Maryland County Health Team on utilizing shared medical equipment to support diabetes self-management and education and peer support for patients attending the Pen Plus clinic. So this is one of our innovative work that was published some time ago now, and this innovative work is still ongoing at Maryland. Next slide. In 2021, the Pen Plus Clinic in Maryland County implemented a structural DSME, which is Diabetes Self-Management and Education Program, where we enrolled like 26 patients living with type 1 diabetes, and they were all educated using the DSME, using the shared medical equipment. Patients were educated in group and then later seen by providers individually. So each of those groups had a leader who led the section as exchanging on self-care prior to being seen by the providers, as you see in the photograph there. So next slide, please. Now, they have good time together before meeting clinician for education and then the evaluation. So we divided them into groups. We have group in Plebo, in JJ Dawson. They name themselves, some of them name themselves success, determination, and consent units. So they take care of themselves before the clinician can see them. They provide how they feel and their experiences through the week before they go to the clinician. Next slide. Now, we conducted a retrospective data review examining routine clinical data from the DSME project beginning May 2021 to December 2023. And we use these indicators: missed appointments, patient knowledge, and feedback from qualitative interview. We also analyze our enrollment. If you see look at the form at the far right over there, is named patient self-management knowledge assessment. This tool was used during the DSME project, where we assess patient knowledge at baseline, and then at 6 months, and then at 12 months in various domains of understanding in diabetes. We scored it basic and intermediate. The general understanding of diabetes, blood sugar level, blood sugar monitoring, insulin dosing. What is the patient basic score? What is the patient intermediate score at baseline at 6 months and 12 months? And we analyze that. Next slide. So when we did this, our results were amazing. Enrollment of type 1 diabetes patients had increased from 26 to 64, which accounted for 246.1%. Patient knowledge for self-care had increased from 33% to 64.6%. Mixed appointment have reduced from 30% to 1.6%. Next slide, please. Increase in enrollment indicates diabetes type 1 service uptake by the Maryland County community. We wouldn't activate the increase in enrollment to the intervention, but it is attributed to that the community has accepted or is accepting the management for type 1 diabetes. We have our qualitative interviews, feeding her and improved understanding were key themes identified among shared medical appointment participants through qualitative interviews. Next slide. So, shared medical appointment model was utilized to empower type 1 diabetes patient knowledge and behavior. Implementing shared medical appointment and DSME in Maryland County enhanced diabetes education and improved care-seeking behaviors. Clinical visit adherence was also enhanced by implementing shared medical appointment. Shared medical appointment facilitated type 1 diabetes patient peer support and activities. there is a need to conduct studies exploring the impact of shared medical equipment on glycemic control. Please, next slide. What are our general discussion on DSME, diabetes self-management education? Is designed to educate and empower individuals living with insulin-dependent diabetes to improve self-management. People living with insulin-dependent diabetes or type 1 diabetes face a lot of challenges such as limited support, literacy, numeracy, and access to care, necessitating additional education and empowerment. This next slide. So this nurse learn model of care, which I'm very much proud of, the DSME model significantly enhances care quality in Maryland County by shifting from a traditional medical model, which focuses on disease absence, medication management, and clinical outcomes. So a patient-centered approach. I always love to underscore this patient-centered approach. Next slide, please. Patient-centered care. This new model emphasizes shared decision-making, behavioral changes, individualized treatment plan, and psychosocial well-being, prioritizing the patient's overall quality of life. Please, next slide. Thank you so much for your listening role. Next slide. And we like to say thanks to the government of Liberia, the MOH, Maryland County Health Team, the J.J. Dawson Hospital, People Health Center, and of course, Partners in Health. Partners in Health is an amazing, amazing organization that provide quality services that our people need. We want to talk to, say hi to Dr. John Tubman, Professor Tubman, of course, our country director, Dr. Manzo. These are wonderful people that will support to making sure that the quality of life is improved for people living with type 1 diabetes. That's the slide. Thank you so much. Any question?
Joe, thank you so much for that incredible presentation. I think it's exciting to see the work that you and your team, and thank you to them for joining us today, are doing to improve the quality of care for patients with type 1 diabetes in Liberia. I think it's so inspiring to see how we can use resources that we do have, which are other patients and each other, to help improve the quality of care. You had a really significant decrease in no-shows from 30 to 1%, which I think is so big. Why do you, I mean, what are your thoughts about why you think that is? And then we'll head to the Q&As.
Okay. So thank you so much. That piece of that result was actually amazing and was kind of shocking from 30% to 1.6%. It was amazing, and that is as a result of the quality of care that is being attached to the diabetes self-management and education program. It's kind of changing from a traditional way of the nurse saying, this is what you need to do, this is what I have for you to do today, and the patient has nothing to say. And but for this one, this model is asking the patient what they are able to do, and supporting the patient using motivational techniques, making sure that this patient understands his or her conditions, and this patient building confidence in a patient. Like, for example, I would say, I trust that you can do this. I'm confident that you can you can do this. You can check your blood sugar like twice a day. You can do it. And those patients will get encouraged. They got encouraged and they felt that they were part of the care, and then they started to make sure they come. And one of the biggest things is that they share medical appointments. They saw their colleagues, people who were them at the same age, experience the same condition, and they explain that, yes, I'm a type 1 diabetes, and then wow, they are not alone. So I think that was the reason why we have that reduction. Yes.
Wow, that's amazing. Thank you for sharing. Diane put a question in the chat. I'm curious. She said, "Thank you so much, Joe. I'm curious if the participating youth experienced stigma around their condition, and if so, how did the study recruit or get past that for study to get participation?"
Yeah, is that I didn't get that web.
Oh, should I say it again?
Yeah.
She's curious if the participating youth experienced stigma around the condition. And if so, how did you recruit youth if they're experiencing this stigma to get past this to join your study? Does that make sense?
Yes. There was some little bit of interruption. I'm sorry.
Okay, no, it's okay. In Liberia, is there a lot of stigma around having diabetes in the youth population? And did they join your study or was it difficult to recruit them?
Great. Thank you so much.
Yeah.
Sorry, I didn't get that. Yes, of course, the stigma for people living with type 1 diabetes. From the start of the program, we were able to assess all of this, and they said that out. Those of them that were in the program, they said that they were being stigmatized as that they are having some kind of illness, that they didn't understand. But at the end of the day, the intervention actually reduced the stigma of people living with diabetes type 1 in that part of the country as we speak.
Mm.
For the part of the matter, they have accepted to even say out their conditions on the radio. They go with us on radio talk shows, call their names. Yes, my name is XYZ, and I have type 1 diabetes. I encourage other people to join us to care for one another and making sure that we have the quality of life. So yes, there are some stigma, but the intervention has reduced some of them at a greater extent.
Amazing. And do you think it affects adults differently than children, or do you think similar?
Adult and children, yes, we have adults in the program, and now we have children. Okay. The children express more stigma as compared to the adults, because the adults were more alert, understanding, because some of them have lived with the situation, with the condition for a very long time now. But for children, they feel that uh, they can do certain things that their friends can do, and so what we did was those adults were part of what we established, we call the patient advisory board, and they were there to give us feedback. Some of them were parents of those patients that are in the DSME program, so they gave us feedback of how their children were feeling, and they also supported the team in encouraging those children on relief of stigma. Yeah.
Incredible. If nobody else has a question, I will ask my next question. I'm wondering, since this was such a successful program, is this technique or style of patient-centered care, motivational interviewing, shared medical visits, is this going to be implemented for other NCDs or other management of population health in your region, or are we just keeping this on the diabetes-centered work?
Yes. Thank you so much. For we started with the type 1 diabetes, and we have three major pen plus conditions that we focus mainly because they are children based. they affect children, like the type 1 diabetes, the sickle cell anemia, and rheumatic heart disease.
Mhm.
And other we have other chronic care conditions, but some will say, why do we look at type 1 diabetes, sickle cell, and rheumatic heart disease? Because they affect children at maybe from age 1 to like under 20. So we also have want to use the same approach for sickle cell anemia. We have the same approach for rheumatic heart disease, to have shared medical appointment for sickle cell, shared medical appointment for type 1 diabetes, shared medical appointment for rheumatic heart disease. These approaches will, will, will enhance the quality of care that these people will have. And for the fact of the matter, we've started the peer diabetes type 1 peer education program. I'm already in Sierra Leone to do the first training for diabetes peer educator. So in the long run, we will have those people be trained to manage sickle cell, being trained to manage rheumatic heart disease, so that they will help and teach others. So this approach is kind of innovative, and then it's patient-centered, and I think it works for all sides.
Wow, it's incredible. I think your work is so inspiring, looking at how nurse-led models of care can inspire patients to lead one another, to collaborate with one another, to decrease the stigma, optimize the health of your community, particularly with a highly burdensome chronic disease. So, really big congratulations to you and your team for the work that you're doing. And we really, truly appreciate you sharing that here with our community today. And I want to say another congratulations to you and your team for being the recipients of our Research Seed Award to do more of a prevalence study of diabetes in your county. Are you excited?
Thank you, thank you, thank you so much. I appreciate that. And I really appreciate my team as well, my nursing team, the NCD team, and the PIH and MOH folks for the support and push to making sure that this happens. And we want to ensure that we are committed to providing the care that these people need living with type 1 diabetes and other NCD conditions. So we are committed to doing that. The the prevalence of diabetes in Maryland County is going to keep up. Trust me, the team is going to do an amazing work to get to the bottom of this. Thank you so much.
Thank you so much, Joe, for your presentation. Thank you, everyone, for joining today. We want to say a big happy International Nurses Day to everyone who we haven't talked to, and International Nurses Week is being celebrated around the world. So happy Nurses Week and Day to everyone. Thank you, Joe, for being here today. Thank you, everyone, for joining. And we wish everybody a really wonderful day. Thank you so much.
Yeah, thank you. Thank
Safe
you.
travels, Joe.
Yes, thank you.